Good morning, students. So today we will talk about Norma lateralis, like whenever we will see skull from the lateral side. Which bones can be seen when we will see skull from the lateral side? So first of all, we can see frontal bone, second is parietal bone, third is occipital bone, fourth is temporal bone, fifth is sphenoid bone, sixth is nasal bone, seventh is zygomatic bone, eighth is maxilla, and ninth is mandible. Now we will talk about some of the features that we can see when we will see skull from the lateral side. First of all, the name of the first feature is temporal lines. The temporal lines begin at the zygomatic process of the frontal bone. First of all, you should know like from where a temporal lines begin. So temporal lines begin at the temporal process of the frontal bone. The name of the bone is the frontal bone, and which process of the frontal bone? That is the zygomatic process. So that's why we say the temporal lines begin at the zygomatic process of the temporal bone, and it arch backwards and upwards and cross the frontal bone, and then coronal suture and parietal bone. So this is the course of these lines. First of all, they start from the zygomatic process of the frontal bone, then they arches backwards, upwards, and crosses the frontal bone, coronal suture, and the parietal bone. Then after that, on the parietal bone, or we can say over the parietal bone, there are two lines. So there are two temporal lines. First of all, first is superior temporal line and second is inferior temporal line. So when they are traced anteriorly, they fuse to form a single line, and when we will just look at them anteriorly, they fuse to form a single line, and when they trace posteriorly, the superior line fade out over the posterior part of the parietal bone, and the inferior temporal line continues downwards and backwards. Actually, zygomatic arch, or it is also called zygoma. Zygomatic arch is a horizontal bar on the side of the head, in front of the ear, and little above the rim. Anterior 1/3 of the zygomatic arch is formed by the temporal process of the zygomatic bone, and the posterior 2/3 is made by zygomatic process of the temporal bone. And above zygomatic arch, there is temporal fossa filled with temporalis muscle, and lower or downward zygomatic arch, there is masseter muscle, and the contraction of both of these muscles may be felt by clenching the teeth. And the next feature is external acoustic meatus. So first of all, it's open just below the posterior part of the posterior root of the zygoma. So its positioning related to the zygomatic arch. So it opens just below the posterior part of the posterior root of the zygomatic arch, and there is a suprameatal triangle. Suprameatal triangle is a small depression posterior-superior to the meatus, and it is bounded above by the supramastoid crest, and in front by the posterior-superior margin of the external meatus, and behind by the vertical tangent to the posterior margin of the meatus. Next is the mastoid part of the temporal bone. Mastoid part of the temporal bone just lie behind the external acoustic meatus, and there is a term that is astrion, that is a point where parieto-mastoid, occipito-mastoid, and lamboid suture meet. Next is styloid process. It is a needle-like, thin, long projection situated anteromedial to the mastoid process, and it is directed downwards, forwards, and medially, and its base partially ensheathed by tympanic plate, and apex and tip is usually hidden from view by the posterior border of the ramus of the mandible. So next feature is temporal fossa. So first of all, look at the figure. The temporal fossa is indicated by the rectangular black lines by rectangle. So first of all, we will study about the boundaries or the margins, we can say. So first of all, from above, the temporal fossa is bounded by superior temporal line, and below by the upper border of the zygomatic arch. What is zygomatic arch? That is a horizontal line that we have studied before about the zygomatic arch. So it is bounded below by the upper border of the zygomatic arch laterally and by the infratemporal crest of the greater wing of the sphenoid bone medially, and through the gap deep to the zygomatic arch, temporal fossa communicates with the infratemporal fossa. And next, the anterior wall is formed by the zygomatic bone and by the parts of frontal and the sphenoid bones. And this wall separates the fossa from the orbits. Obviously, like in front of the anterior wall of the temporal fossa, it's orbits, and which thing which ball separates the temporal fossa from the orbit, that is the anterior ball that is made by zygomatic bone and by the part of frontal and the sphenoid bones. And last part of this topic, that is the floor of the temporal fossa. Now the floor of the temporal fossa, first of all, the anterior part of the floor. The anterior part of the floor is crossed by a H-shaped suture. H-shaped suture where four bones, which four bones? Frontal, parietal, greater wing of the sphenoid and the temporal bone adjoin each other, and this area is termed zatrion, and it lies 4 cm above the midpoint of the zygomatic arch and 2.5 cm behind the frontozygomatic suture. And deep to this lie the middle meningeal vein and the anterior division of the middle meningeal artery and the stem of the lateral sulcus of brain. Next is infratemporal fossa. Infratemporal fossa is a space between the skull base and the lateral pharyngeal wall and the ramus of the mandible. This fossa is actually open to the neck posterior-inferiorly, and in doing so has no true anatomical flow. Next is pterygopalatine fossa. It is a small, clinically inaccessible, fat-filled space located in the deep face that serves as a major neurovascular crossroad between the oral cavity, nasal cavity, nasopharynx, orbit, masticator space, and the middle cranial fossa. So first of all, we can say PPF is a small, clinically inaccessible fat-filled space which just serve as a neurovascular crossroad because there are so many nerves that going through this space. So first of all, the PPF contains fat and the pterygopalatine ganglion and maxillary division of the trigeminal nerve and its branches and the infraorbital nerve and the distal branches of the maxillary artery and few emissary vein. Thank you so much for watching. For more videos like this, do like, share, subscribe, and leave your comment below. Thank you so much. Have a good day.